This is critical thinking on the lymphatic system, and here are 3 questions, and I've tried to kind of choose different formats. Here is a question on what is typical in histology of a particular tissue. Here is a clinical question, and here are certain statements, and you have to choose the incorrect statement. So let's go to the first one, where it says which of the following would be typical of thymic histology. And it says typical of thymic histology, which means that this is only present in the thymus and nowhere else. So then the presence of cortex and medulla is not typical of thymic histology only, because this cortex and medulla are also seen in the lymph node. The second one, presence of lymphocytes and macrophages. Now, all lymphatic tissue has lymphocytes and macrophages, so the thymus is not the only one which has that. The third statement, presence of pink onion skin-like structures. This is true of the thymus only, so therefore this is the correct answer, because those pink onion skin-like structures are the Hassel's corpuscles, and no other lymphatic tissue has this kind of presence of this structure. Therefore, this is the correct answer. Let's look at the other two just so we rule those out. Presence of epithelium. Now, epithelium, you know, is not present in the thymus. It is present in the tonsils. So, therefore, this is not true either. And presence of red pulp. Now, red pulp is present in the spleen. So, therefore, this is also not true. Therefore, this is the correct answer. So when you get questions like this, what is typical, then you have to think that this is only present in this structure. For example, if a question asked you, how would you distinguish thymus from the lymph node? So then you'll have to see what is that which is typical of thymus but not present in the lymph node. So therefore, this is the correct statement. So let's look at this question now, which is what would be a likely effect of enlarged palatine tonsils. So hence you must know where the palatine tonsils are present. And if we look at this PowerPoint slide and you look here, notice how the pharyngeal tonsil and the tubal tonsil are present in the nasopharynx. So this area, they're both present in the nasopharynx, whereas the palatine tonsil and the lingual tonsil are present in the oropharynx. And again, if you see here, this is pharyngeal, tubal, palatine, and lingual. So now if the palatine tonsils are enlarged like this, so then they would block this oropharynx in this area. So they would block that. So again, if I was to draw it, and if it's really enlarged this way, so it would be very difficult to swallow, because, you know, from both sides, as food is passing, it has to pass between these enlarged tonsils. So when you swallow, obviously there would be difficulty and you'd feel some pain. So therefore this would, that is what palatine tonsils would cause. If there were enlarged pharyngeal tonsil, if the pharyngeal tonsil on the other hand was enlarged, as we see when we have, when someone has adenoids, then breathing becomes a problem. So you can see this, that now, you know, air has to flow through a narrow space. And if tubal tonsils were enlarged, you can understand it's sitting on top of the eustachian tube, it would compress the eustachian tube. Therefore, the correct answer to this question would therefore be person would have difficulty swallowing. So this would be the correct answer to this question. Now let's look at the last question, and here it talks of a number of statements and you have to look at the incorrect statement. So here you really have to know your material and you have to read every word very, very carefully, because sometimes you expect to see something and you see it, whereas something else is written. Now let's look at these statements. Lymphatic nodules are absent in epidermis, and this is a true statement. So this is not the one that is the correct answer for this, because lymphatic vessels and lymph nodules are present in structures which have a blood supply. Epidermis is avascular. So avascular structures like the epidermis, cornea, they don't have lymphatic nodules. So therefore, this is a true statement. So this is not the answer that we're looking for. Then up here, compared to afferent vessels, there are fewer efferent vessels in a lymph node. This also is a true statement. And again, just to show you, I've opened up one of your PowerPoint slides which you have, and notice, see these afferent vessels on the convex surface. See, there are 3 of them. And efferent, there's only 1. And there's a reason for it, because as lymph flows through these vessels and passes through these follicles here and then through the sinuses, it gets held back. It sort of stays here for some time so that the lymphocytes and macrophages can act on it, and then it passes into the efferent vessel. So this is a true statement. So again, to go back, so this statement is also true. The next statement, lymph flow is towards the heart. Now this, I have a picture that I want to show you. And this is a picture I have in my in-class lectures. But anyway, this just shows you, if you think of it, where does lymph finally go? It goes into the veins, and in the veins it goes into the junction between the subclavian and internal jugular, and then finally into the right atrium of the heart. So lymph flow is towards the heart. And look at this image from below. Again, it's going up towards the heart. So, you know, the thoracic duct and all those vessels take it upwards. And from the head and neck and the upper limb areas, you see that it's coming down, but again, towards the heart. So therefore, lymph flow is towards the heart. So that again is a correct statement. And this statement, the epithelium lining of the different tonsils differs as their functions are different. So this seems to suggest that the functions of the different tonsils is different, and that's why their epithelial lining is different. Now this is wrong. The function of all the tonsils is the same. The reason the lining is different is because of where they are present, the region where they are present. All the lymphatic tonsils which are present in the nasopharynx will have pseudostratified ciliated epithelium, which is the epithelium of the nasopharynx. Those which are present in the oropharynx will have stratified squamous non-keratinized. But so it's based on the region, not because their functions are different. So this is an incorrect statement. So therefore, this one is that. So let's look at the last one, where it says an injury to the spleen could injure the left pleural cavity. And again, this is a picture of the spleen that you have in your PowerPoint, and you know the spleen is present in the left hypochondrium. So you can see here it is related to the left pleural cavity. So if there's an injury, it could injure the left pleural cavity or any of the organs which are close to it. So hence this statement is also true. So if we come back here, so the only incorrect statement is this one. Therefore, this is the answer to this question here. So this way, I would like you, whenever you're answering these questions, think and read very, very carefully and pay particular attention to your images, because those really help you to answer many of these questions.